You're watching CTOM TV. Knowledge is power.
Edna would like to know what is the best treatment plan or management for stage 1 endometrial cancer?
Well, I think that is a wonderful opportunity to be applying the tools we've discussed here. Definitely, I would be leaning towards immune therapy right off the bat. However, the most important thing is getting the proper testing, getting tumor DNA sequencing and expression testing. You spend the money now on those two tests and it will benefit you for the entire course of the disease and the rest of your life. It's so important to know what drugs are going to be useful for you, what things will work for you, what won't. And the only way to determine that is by spending some money on diagnostics. It'd be the best investment you could make. Tumor DNA sequencing and RNA expression testing.
Well, for two reasons. One, because then but again, because then your doctor has the evidence they need to go off book to not just follow the standard protocols of what they're allowed to offer you when. So that's how you get that personalized treatment, is by making sure you've got those personalized diagnostics. Yeah. Mary, can we get liquid biopsies in Edmonton, Alberta? Yes. We arrange the service for Canadians, no matter where they live. We just arrange a nurse to come to your home and take the blood for you, and then the sample is shipped to the sequencing lab. And you don't have to go anywhere for DNA sequencing. No. A simple release form gives us, or another service you might use, permission to get a hold of your tumor sample from the pathology lab that will be holding it. They typically hold these things for about 20 years. So even if you had a biopsy 10 years ago, it's probably still there. And if you just fill out a form to grant us permission, we can access it and take care of all the testing and then follow up with you once we have results, which, depending on the test, can be anywhere from 4 to 8 weeks as a rule. Question from Allison. Will the CA125 go up during pseudo progression? And also, how accurate is the CA125?
It's a blood marker. It's a marker of earlier stem cell, sort of progenitor stem cells. It's not a tumor specific marker. It's not specific to cancers. It's specific to a certain type of cell at a certain stage of its life that is common in cancers. So I wouldn't, I don't like these markers. I would say CEA is probably used a little more, but it's the same sort of thing. We like to measure with, molecular features like genes and so on. So it's not very accurate. I've seen cases where it's high and the patient had low tumor burden or benign situations, and I've seen it low when person's had stage 4 metastatic disease. So
it is one of those tests like they have in prostate cancer, where it was a helpful tool when we didn't have anything better.
Exactly. There is a good question there. She mentioned, will the CA125 go up during pseudoprogression? I don't know about the CA125, but I do know that the CEA will be low during pseudoprogression. And that's actually what some doctors are starting to look at now. They'll look at the CEA and show, okay, it's low. You probably have pseudoprogression. So definitely there is some association between CEA and pseudoprogression.
Okay, thank you. All right, so we have, let's see here. Was there anybody who was here wanting to ask your questions directly about your case? If so, can I get you to either put your name in the chat or just say me, or put up your hand? I see that we have somebody here. EA Price. Not sure what your first name is. So we'll certainly answer your questions, but I just want to let anybody else know, if you have something specific to your case, please do either post the question in the chat, or just let me know that you'd like to ask it directly, and we'll get you chatting with Alex for your direct live consult. And Allison, just before we go into answering specific questions for specific cases, we are worldwide, not just nationwide, and it's really easy to work with us. You simply just shoot us an email or visit our website, fill out our contact form, and let us know that you'd like to meet with us and discuss your case. You'd have an initial consultation with Alex after we gather a little bit of your medical history and he's had a chance to review some of the details of your case. You'd have your initial consultation with him. From there, he'd make some recommendations for next steps for treatment or further diagnostics. And then our team would kick into gear and make that happen for you. And we would liaise with your oncologist there, giving the information to them and being available to them, specifically Alex and his team on the research side, to answer any questions they might have about any of the treatment recommendations that we're making if they're not familiar with using those drugs. We also have oncologists that we can connect you to if you need a new one or want a new one. And we also can have those oncologists speak to your oncologist to help them to feel more comfortable about some of these innovations in treatment. Because one of the main concerns that oncologists have is, if I've never run this protocol before, and is kind of brand new to the country, they'll want to know a little bit more about how it works. And so we can help coordinate that as well. A client that I met with recently said, after working with us for a few months now, she said, you know, you guys are like a concierge for cancer. And that's what I've always called us, the cancer care concierge. So think of us as, you know, we're going to tell you where the best place to eat, the best place to see a show, the place you got to go shop, all the stuff. And we can get the cab and take you there, or you can figure it out yourself, however you want to do it. But think of us like that.
Thank you for watching Cetome TV. Subscribe below and stay informed.